Thank you. I am delighted to be here today, and I'm really excited to be talking about rural health at an urban health symposium. I actually think if you are not already interested in rural health, I hope that this can make you interested in rural health. I think at our best, rural and urban areas work together symbiotically, and if you don't already care about rural areas, I assume that you care about the food that you eat and the energy you use and the places that you like to travel to or travel over. And so let me convince you that you care about rural places. And I also think that our last presentation or last panel really teed up what I'm going to be talking about today, social isolation. We heard about how difficult it can be when older adults are living alone and don't have people in their lives. That's really the focus of the project that I'm going to share with you today. And I'm sharing this with you as part of the work that we do at the University of Minnesota Rural Health Research Center, where I'm the deputy director. We're funded by the Federal Office of Rural Health Policy. And with the work that we do, we are charged with doing 4 projects a year. They all have to be really policy relevant and timely. And so this is different than some research where it's not really a deep dive, it's more of a broad scan of some of the issues and how they relate to rural health and policy. But I think that social isolation offers a really nice example, a nice test case of other health issues in rural health. And so this will give you some ideas of some of the main things that we wrestle with when we're thinking about rural health, regardless of what the health condition is. So first of all, social isolation and health, I assume, because this is a public health audience, that I'm preaching to the choir here. But just in case you need some convincing about why this is important, social isolation or community connectedness, as the flip side of it, is not a new concept. Humans were wired to live in community, live with one another. But we recently have gotten better about paying attention to this as a a public health issue, with headlines like this, how social isolation is killing us. Loneliness begets loneliness. We've seen research coming out showing that the impact of being lonely or being socially isolated is similar to that of smoking half a pack or a pack of cigarettes a day, to being morbidly obese. Social isolation has that same impact on health and mortality. We know that being socially isolated, that is not having a lot of people in your life, or having people in your life but still feeling lonely, feeling like your social needs are not being met, is associated with increased risk of Alzheimer's disease, poor cognitive functioning, poor immune system functioning, blood pressure, heart disease, stress, substance use, depression, and mortality, including from but not limited to suicide. The extent of social isolation, it's a massive problem. Some people are calling this a crisis, maybe not a disaster, but a crisis, thinking about some of our terminology from the last panel. Thinking about older adults or people on Medicare, who are mostly older adults, alone, it costs the Medicare program almost $7 billion annually. That was a recent study that was done to try and compute some of the costs of social isolation. There was another really nice survey that came out from Cigna in 2018 that said that nearly half of Americans feel alone or left out always or sometimes. You've probably seen some of this work. If this is an area that interests you, you might see yourself in some of these statistics. It's not an unusual thing to feel lonely, to feel left out. It becomes a health problem when it's chronic and when there aren't any resources to help people with that. So, social isolation in a rural context. Why should we care about this with a place-based lens? There's not a lot of research on rural-urban differences in social isolation, and that's where I tried to pick up the pieces and see what differences there might be. And the reason I suspected that this would be really important and that there should be a place-based lens on studying social isolation is because rural areas are really different than urban areas in really important ways. They're demographically different, and by that I mean that they tend to be quite a bit older. We know that social isolation impacts older adults differently than it does younger adults. They have fewer economic resources, fewer healthcare resources. And there are practical challenges related to infrastructure, transportation, distance between one another. If we counter social isolation by finding ways for people to connect with one another, it's harder to do that when people are disparate. So I'm just going to share some really broad findings with you. If you're interested in a deeper dive, some of the findings I will share with you are published in the Journal of Rural Health. Some are published in freely available policy briefs that we have on our website. I'm also happy to talk with you if you want to follow up with me. But just to give you a sense of what I'll talk about, we did an analysis of the National Social Life, Health, and Aging Project study. This is a really robust data set. If this is an area that you're interested in, it'd be worth checking out. It's of older adults specifically, and it asks them all sorts of questions about their social relationships, also their sex lives. I won't talk with you about that. If that's interesting to you, check it out. But really, really an interesting data set. And so I'll share a few quantitative findings from that, and then I'll share a few findings from a very, very small-scale qualitative study that we did as part of this, where we talked with 22 experts in the area of rural social isolation from across the country, and I'll share a few of the themes that we heard from them. And just to give you a better sense of this data set, some of the social isolation measures that it includes: social relationships, support, loneliness, social participation, how often people are going to church or temple or getting involved in a hobby group or a choir, and then marital status, which is obviously important for social relationships. There's a whole science to how we study isolation and loneliness. I'm not going to dive into that, but if this is an area you're interested in, make sure you immerse yourself in that literature. So just a few differences that we found here. I'm looking at older adults by whether they live in an urban or metropolitan county, or whether they live in two different types of rural counties. Since this is more of an urban health audience, I'll tell you about these rural counties. Micropolitan counties are rural counties where there might be a small town or a small city of 10,000 to no more than 50,000 people. And so you can think of it as a county with about 50,000 or fewer people. Non-core rural, these are our most rural counties. These are counties that don't have any town or city with 10,000 people. They might have 10,000 people spread across the county, but not living all together. And here we found that by and large, people in the rural counties, especially non-core rural counties, have more close relatives in their lives. We know that this is true. We know that rural folks tend to have bigger families. But we also found that they have more friends, so they have stronger social networks. But we found that folks in non-core rural counties were significantly more likely to report that they sometimes or often are feeling left out. This is one important measure of social isolation. What this tells me from a place-based lens is that it's not enough to only count the number of people in someone's lives, but you need to understand the quality of those relationships and whether they have the mechanisms in place to really facilitate meaningful interaction with other folks. We also did some regression analyses, because it's not good public health data work without some regression analyses. I'm not going to go into depth on these, but just to give you a sense, we saw that being married or partnered was associated with less loneliness across geography. But race had a different impact depending on where you lived. And we found that for folks living in the most rural counties, if you were Black, you had a much higher rate of being lonely. I think this needs a lot more work to dig into this, to understand some of the racial and ethnic differences in social relationships across geography. And we found that hearing, I didn't talk about this before, but that if your hearing was limited, if you had difficulty hearing, that you were more likely to feel lonely in urban and in non-core rural environments with less of a relationship there. For micropolitan rural environments, again, I think more work is needed to understand how disability and functioning impacts social relationships differently in different places and contexts. So I'm just going to give you, that was a really, really quick dive. Those results are published if you want to see them more. But I want to give you a little sense of what we heard when we talked with people who are doing some of the on-the-ground work in social isolation in rural contexts. And when we talked with people, 5 themes emerged from these interviews that we did. And these were themes around transportation. And I'll tell you that in the work that I do, I study a lot of issues across rural health. And it almost doesn't matter what I'm studying. I know that transportation is going to come up as a barrier. I know this to be true in urban environments, too. Transportation is not uniquely problematic or challenging in rural environments, but I would argue that it's more problematic and more challenging in rural environments because there's less available and larger distances to travel. Technology came up as an issue, both as something that can help facilitate social relationships and facilitate disaster relief planning, but also something that can be a hindrance. Rural areas are less likely to have access to reliable broadband internet. Folks in rural areas are less likely to own personal computers, smartphones, cell connectivity is not as good in rural areas. For all of those reasons, the ways that we expect that people to connect with each other work differently in rural areas. Demographics came up. Again, rural areas are aging faster. We heard about that a lot. We heard about outmigration of younger adults, and we heard about a real need for more intergenerational connectedness. We heard about access to resources. Funding is limited everywhere. Funding is particularly limited in rural areas. Spaces, places where people can congregate and get together are also more limited in rural areas. And then we heard about this sort of amorphous concept of rural culture. I say this with a lot of caveats. Rural areas are not monolithic, neither are urban areas. There's not one rural culture. That said, we hear a lot when we talk with folks in rural areas about this sense of wanting to help one another, wanting to know your neighbor, a lack of anonymity in rural contexts, and that came up as an important theme. I'm not going to dive deep into all of these, but I just want to share a few quotes with you. And as I said, I think these are applicable not only for social isolation, but across a range of health issues and how they relate to place. So for a quote related to how people are getting together, here's what we heard. If you're in an urban environment and you want to live alone and everything like that, you can still see homes from where you live, almost by definition. A lot of our rural folks, they can't. It takes a lot or a little bit more to interact with neighbors. So place-based lens, it just takes a little more effort to get to know people, to see people, to know if your neighbor is doing okay if you can't see your neighbor from your window. This was related to transportation, and this is something that's not unique. We hear this sort of story all the time. Our bus doesn't run on Sundays, so you're losing that whole weekend day that you could say, hey, we're going to have a big picnic at the park, because you have to figure out who's coming and who needs rides, and the logistics are really, really hard. This was someone who works with recent immigrant families into a rural community and was trying to organize a group of young parents to get together. And they were only available on the weekends, but public transportation didn't run on the weekends, and some of them didn't have their own vehicles, and so they just couldn't make it work. The last quote I'm going to share with you is, we have this great idea going out, but can't do it because people in the smaller communities have no internet access. There are no cell signals in that area. There are certain places where there are dead spots, and that's where people live. We heard about how important social media is when there is a disaster. Social media is also really important for how we connect with one another, for better or worse. I could talk about that for hours. But if you're trying to organize an event or help people connect with one another and they simply aren't connected, they're not on the grid, we're losing a bunch of people. We're missing out. So just a few key takeaways. Social isolation is an urgent public health issue, offers unique challenges in rural areas and in urban, and is fascinating to study from an urban standpoint too. And any solutions to address social isolation need to be place-based. This, just by definition, interacts with how our neighborhoods work, how our communities work, and how we interact with one another. And so there's not one-size-fits-all solution when we think about social isolation. And I think before the stop sign went up, I finished. So thank you for letting me talk about rural at the Urban Health Symposium. I'm glad you humored me, and I was really glad to be here.